For women like Jess with lymphangioliomyomatosis, whether or not to become pregnant is a very difficult decision. The 28-year-old recently married, and with her rare lung disease, she knows it's crucial to first seek advice from her GP.
I think that's a very difficult topic because we're aware that pregnancy may exacerbate their disease. So it is one of those times, as with lots of the chronic conditions, that young woman should see a specialist before any pregnancy. In the planning stage, she should discuss it with her consultant and an obstetrician physician so that she's aware of all of the issues before she gets pregnant.
Jess's respiratory specialist, Dr. John Colby, has seen more women with LAM than any other specialist in New Zealand. While they can have uncomplicated pregnancies and sporadic LAM can't be passed on, there are risks to be considered.
Whilst some studies have taken place, we still don't know a whole lot about what happens to women with LAM who become pregnant. There are case reports of women with LAM having accelerated decline in lung function associated with pregnancy. There are also reports of worsening of the kidney tumours and bleeding from the kidney tumours during pregnancy. So my advice is that if the woman wants to consider becoming pregnant, that's one of the things that they need to discuss in detail with their respiratory physician.
Emilita's first indication of LAM came 9 years before she was diagnosed, when she was pregnant with her second child.
It was normal, a pregnant woman, until one time anyway. I remember it was nighttime. I was just suddenly out of breath. Yeah, it's like an asthma attack. That's what I thought it was. Yeah, so I'm sure I rang somebody, a doctor or something that night, if it's allowed for me to take the inhaler. They said it's fine. I did take it, but it never worked. Yeah, so the ambulance took me to hospital to get oxygen. That was a relief anyway. So I thought, must be asthma then. That's what they said, I've got asthma. Yeah. Sent me home. And looking back, doctors, why they do that? They never really thoroughly check you instead of guessing anyway what it was, Yeah.
Like Emilita, many LAM women have children before they're diagnosed. While shortness of breath during pregnancy is not uncommon, doctors need to be aware some women may have to be referred to a respiratory specialist. A survey called Pregnancy Experiences with Women with Lymphangioliomyomatosis was published in Respiratory Medicine in 2009. Its objective was to determine pregnancy and health outcomes in LAM to provide better evidence with which to counsel patients contemplating pregnancy. 328 women with LAM were surveyed. Almost 2/3 of women had been pregnant at least once, the majority before LAM was diagnosed. Overall, as far as premature births and miscarriages were concerned, those diagnosed with LAM during pregnancy had a worse pregnancy outcome than those diagnosed before or after pregnancy. Also, pneumothorax, breathlessness or other respiratory problems were suffered by more women whose LAM was diagnosed during pregnancy than those diagnosed before or after pregnancy. Dr. Simon Johnson was one of the authors of that survey. He's a professor of respiratory medicine at Britain's Nottingham University and director of the National Centre for Lymphangioliomyomatosis, where around 120 LAM patients are seen regularly. He says pregnancy in LAM is associated with an approximately tenfold increase in the risk of pneumothorax and may require surgery during pregnancy. These pregnancies are also more likely to end early, with an operative delivery due to complications or concerns about the effect of natural delivery on the mother and baby. It's not known if pregnancy accelerates decline in lung function. However, Dr Johnson says one small study showed a slightly lower lung function in those women who became pregnant after LAM had been diagnosed. LAM is not an absolute contraindication to pregnancy, but it's clear doctor and patient need to discuss the risks carefully and decisions made on an individual basis.